Hello, everyone, and welcome to this audio podcast as part of this analysis of the analysis edition. This is an audio podcast as part of a manuscript Cyclone a Bostic Summit analysis, an audio podcast, in around the analysis edition as part of another Storm Robotics production. This In this overview, there will be sort of an sort of updating works in around sort of an overview, sorry, in around updating works, in around works that originally had been peer reviewed and published in around 2015 looking at the Lord Mayor of Bristol, Bristol's blood and organ sort of donation campaign. Here goes. So around three people die each day across the United Kingdom due to a shortage of organs, and there are about 10,000. There have been documented evidence around 10,000 people in the United Kingdom in need of a transplant. One of the ongoing contentions One of the ongoing contentions is that people who require blood and organ transplant can be waiting for a number of months to years for a suitable donor to come forward. Another important reality is that people die waiting on the transplant list, and this is regardless of age and race. In association, a percentage of people who develop a specific health complications, which then precludes them being suitable to transplant. There are still sort of issues, and the main being that people from different ethnicities are still not always completely aware of organ donation or transplantation, and how it can help save lives. So retrospectively, only 4% of the eligible population across England and North Wales regularly donate blood, and of these donate blood, and of these, for example, it had been evidence that only 4% only 4% are from BAME, Black and Asian or minority ethnicity backgrounds. Hospitals in England and North Wales need around it has been documented that hospitals in England and North Wales need around 7,000 units of blood every day to treat patients with a range of health issues, from cancer, thalassemia, and sickle cell anemia to those involved in accidents or suffering blood loss in childbirth. Following the publication of the All Parliamentary Party Kidney Group, or APPKG, and the National Kidney Federation (NKF) from 2012 manifesto on improving kidney donation and transplantation in BAME communities, and faith engagement and organ donation action plan through the National Black and Asian and Minority Ethnic or BAME Transplant Alliance, or MBTA 2012. The Law Mayor of Bristol's campaign aimed to encourage people from BAME groups to sign up in greater numbers to blood and organ donation register. The campaign took place in collaboration with the Bristol Multi Faith Forum (BMFF), the Renal Patient Support Group (RPSG), NHS Blood and Transplant (NHSBT), and two radio stations, Eugenia Radio Station and BCFM Radio Station. The campaign initially began in September 2013 at the Lord Mayor's Mansion House, and faith leaders and representatives were invited to the event, along with donors, recipients, and NHS NHS blood and transplant staff. The media were involved, which led to two radio stations and a local TV interview. Leaflets and banner stands were produced specifically for the Lawmare's campaign, and members of the public from different communities spoke about experiences, and this was powerful. The campaign had seven strategies regarding the following objectives. So so advice on issues relating to culture and religious sensitivity, publicize the campaign to BAME groups, faiths, and communities, promote the campaign using community leaders, develop a rollout of community champions, assist the community in undertaking a role, and support community events and forums. The Lord Mayor of Bristol's campaign surrounds seven strategies. Number one, in around education. Number two, awareness and promotion. Number three, science behind blood transfusion and organ transplantation. Number four, ethics. Number five, religious and cultural beliefs. And number six, taking ownership. And number seven, reporting and dissemination. Those from BAME and mixed percentage backgrounds have been dying in disproportionate numbers because of difficulties faced in trying to find an appropriate matched donor. One of the main reasons for this is that there have not been enough individuals with specific genetic history on national registers, and even when there are, cultural and other barriers that can hinder transplants from proceeding. And this is also a lack. And there is also a lack of the organ donation register and data. There is also a lack of understanding of the organ donation and register and data, and this suggests challenges across all communities. The Lord Mayor of Bristol aimed to highlight where service providers and members of the public can take ownership in meeting challenges, thus providing importance of blood and organ donation or transplantation, and educate people from all backgrounds, faiths, to sign up to the blood and organ donation or transplant register. Was one of the main strategies. So now, hearing a sort of hearing now sort of a perspective on the different strategies in some depth. So in around the education strategy. So education surrounding organ donation transplantation remained a main aspect. In reminding those who are willing or wanting to donate organs. Retrospectively, organizations involved have endeavored to provide education and understanding on blood and organ transplantation or donation to people from all races and backgrounds. This strategy surrounding campaign aimed to utilize several approaches to prompt outcomes. One of the main aspects had been to ensure that there is more understanding of organ donation and transplantation registries in the United Kingdom. Several outcomes have been achieved through this strategy, including one radio shows between three local radio stations in Bristol City. The radio stations included Ujima Radio, BCFM, and the BBC and BBC Radio Bristol. The opportunity allowed those working between different organisations, included the Renal Patient Support Group (RPSG), the NHS Blood and Transplant (NHSBT), and Bristol Multi Faith Forum (BMFF), and radio station leads highlight perspectives surrounding issues in around disease etiologies aligned to organ donation and transplantation. Number two are online e-sessions involving patients and health professionals over a 4-day duration, and surrounding theme how social media can help raise CKD awareness, and had been initiated. Number three are campaign driver training seminars which encourage drivers and champions to collaborate, representing respective organizations, and to structure campaign aligned to educational activities. Number four, relating to evidencing of works focusing on peer review and literature and faith-based publications. The campaign drivers or champions aim to ensure that literature that could be integrated into different events, and where literature would be offered by the NHS organisations such as NHS Blood and Transplant, and also aligned to the Renal Patient Support Group, the RPSG. In addition, there would be an aim to ensure evidence-based works are provided, highlighting issues of blood and organ donation or transplantation across faith groups. And five, there was an effort to integrate literature aligned to Black History Month as well, and thus a stand was organised at Bristol City Hall, wherein one of the leads representing NHS Blood and Transplant blood donation team aimed to raise awareness on blood and organ donation in BAME groups, and offer visitors information on the Lord Mayor's campaign in context of Black History Month. So in around the awareness and promotion sort of strategy. So several outcomes had been achieved through this strategy, including one, keep a diary project, and the keep a blog or diary project aimed to involve and encourage patients from diverse backgrounds to keep diaries to highlight or raise issues and challenges of being on the organ or transplant waiting list. Number two, media attention effort. So prior or before the start in the sort of more formal activities regarding the Lord Mayor of Bristol's campaign, the RPSG, the Renal Patient Support Group, aimed to promote more awareness surrounding kidney disease, for example, and organ donation and transplantation in support of World Kidney Day 2011 and 2012. And the aim was to provide better comprehension of how social media could help promote awareness on in around sensitive and pertinent subjects or topics surrounding transplantation. Number three, Bristol Multi Faith Forum, health and well-being event, and the aim was to implement free workshops on blood and organ donation and transplantation, health and well-being, and in around clinical commissioning. The BMFF, or the Bristol Multi Faith Forum event, invited the public to find out more relating to blood and organ donation and transplantation, in addition to aspects of the campaign. The events also anticipated providing free checks, free sort of health checks, healthy lifestyle leaflets and advice on various and advice and various at various information stores accordingly. And number four, sort of an awareness day, and this was a joint decision to there was a joint decision to hold an awareness day and sign up to sign up to register event day in a main shopping district in Bristol City in around 2014. Fellow drivers and champions and colleagues from respective organizations assembled to provide specific literature surrounding blood and organ donation, transplantation, and enabling public to ask questions and to talk and discuss important issues, helping to raise awareness. The sign up to the register event was also promoted through the two local radio stations, local radio stations, UGMA and BCFM, inviting professionals and patients. In around the in around science behind transfusion and organ transplantation strategy, primarily the work of prospective transplant for a recipient is through the immunological based assay to determine antibodies through recipient's human leukocyte antigen or HLA system. HLA specific antibodies were first detected and characterized by were first are first detected and characterized by agglutination or the sticking of the sticking of cells sort of laboratory sort of procedure. However, until recently, the most broadly available technique used relied on the ability of antibodies to fix complement and cause cell death. Complement dependent cytotoxicity or CDC is also a technique that can be used to cross-match recipient serum against donor leukocytes or white T cells and purified from blood. If a serum sample is tested against a panel of white cells from donors with a range of different HLA types, it is possible to identify the specificity of antibodies from the reaction patterns with cells carrying different HLA types. Now, this has always been an issue because some tissue types tend to occur in specific combinations of HLA antigens, giving rise to a range of random interpretations. Several outcomes have been achieved through this particular sort of campaign strategy, including number one, clarity in and around the organ donation register, and the basis of around this objective sought to involve health professionals to provide more understanding of the organ donation register or ODR. Number two, the science behind blood and transplantation. NHSBT or NHS Blood and Transplant or NHSBT was approached to provide more insight on the science behind tests and investigations, and there was a basis wherein health professionals would provide public understanding on acute kidney injury or AKI and CKD, chronic kidney disease, aligned to public health. Acute kidney injury and CKD progression can be identified by elevation of creatinine and other biomarkers. Biomarkers are not directly toxic, but useful tools in the laboratory for the analysis in around renal function. And creatinine depends on glomerular filtration rate or GFR, and glomerular filtration tubular secretion is higher in serum creatinine in males versus females. And several parameters in kidney disease are documented as important, including urea and creatinine levels in chronic renal failure or CKD, chronic kidney disease, pre and post transplant, pre and post dialysis recipients. Number three, there was and number three, NHS blood and transplant blood tour, and the Lord Mayor and campaign drivers of champions were invited to attend the largest blood processing and manufacture department in the world's largest NHS blood and transplant site, NHSBT site, to view how blood is prepared after donating and before issuing. The aim of the blood tour was also to provide a better understanding of the whole manufacturing process and science behind blood in Europe's largest blood processing and laboratory site in Bristol City. There remains a requirement to provide an understanding of laboratory tests and biomarkers, and several recent works investigate from allied health professional involvement to providing science education and public health basis behind transplantation and healthcare. So now in around sort of the ethics strategy. So several outcomes have been achieved through the strategy, including one, implementation of educational webinars surrounding ethics of transplantation, the ethics behind blood donation and organ transplantation has always been a focus when when public are considering formal decisions to go forward to donate. Perhaps not immediately, but when getting into the deeper aspects of understanding whether they should or should not donate. Ethics always has a role to play, always has a basis. The strategy sought to involve this strategy sought to involve health professionals to take on the role of actively disseminating evidence-based literature and perspectives on organ donation and transplantation process, so the public receive an understanding of transplantation, precluding any misconceptions. From a primary care perspective, an ethics process should either be British Medical Association led or BMA led, and or British Transplantation Society or BTS led in secondary care through the BTS. And more recently, there have been works published exploring the again sort of using social media or mainstream media to prompt organ donation or transplantation education, in works by Mohammed and team in 2019. Under this strategy, the aim was the aim was to also have highlighted perspective from health professionals. So, for example, donating a portion of a singular organ like a lobe of the liver is permissible on the condition that the donor's health is not placed at risk, and the likelihood of a successful transplant is high. If the organ forms one of a pair, such as a kidney, then it is permissible to donate should it save the life of a recipient and not result in permanent damage to the donor. As the kidney population increases, or the CKD sorry as the CKD population, chronic kidney disease population increases, professionals in around the specialty of nephrology and also in around general medicine should seek to expand ways in service provision. In line, it would be adept to involve healthcare scientists to provide sort of educational support relating to tests and investigations in the workup of for example, establishing appropriate results and blood trough levels for dosing immunosuppression, and B, provide educational support in the workup of organ transplant around organ transplantation. So, for example, i.e., serological tests, lymphocytotoxic T cell and antibody tests or investigations. And again, works by Mohammed and team in 2019 have highlighted some bases around this. The campaign drivers and champions projected that NHS Blood and Transport, NHSBT, should endeavour to invite people from all backgrounds and faiths on blood tours at Europe's largest blood manufacturing processing centre in Bristol. Those who attend the blood tours would also have an opportunity to ask specific questions about donation and the handling of components, and the science behind blood transfusion and transplantation. Perspectives from healthcare professionals such as scientists on this important entity are still required. In the United Kingdom, cadaveric organ donation or transplantation takes place in two forms: donation after circulatory death, or DCD, and donation after brainstem death, or DBD. In DCDs, organs are retrieved following asystole, and in DBDs, retrieval begins when the function of the blood brainstem is permanently lost, leaving an individual irreversibly unconscious and capable of breathing independently. One initial projection that was also part of discussions during the campaign on the initiative was that on any medical admission forms used to admit patients into hospital, this could offer a good opportunity to prompt whether a patient would consider organ donation or transplantation. Opportunity may also arise considering do not attempt resuscitation or DNAR form. And it was projected that this was initially be in discussion with general practitioners or GPs to have it formalized at primary care level. So in around the sort of the in around now sort of faith and cultural belief strategies. Um, Several outcomes have been achieved through this strategy, including visits by the Lord Mayor of Bristol and NHS Blood and Transplant team to one sort of a Bristol Sikh faith, a Muslim faith a sort of dinner event. Number two, an awareness event at a mosque in one of the main mosques in Bristol City. Number three, another a mosque in Bristol City. Number four, another number four, number four and five, another mosque, another two different mosques in Bristol City, and number six, a Hindu temple a Hindu temple in Bristol City as well. And there have been an effort by collaborators from the Bristol Multi-Faith Forum, who anticipated placing together a summary of efforts through campaign into BMF, into the BMFF news magazine, and this would be available through the BMFF Bristol City Council websites. NHS Blood and Transplant colleagues and collaborators had also anticipated putting together a summary of religious or cultural beliefs, religious and cultural belief strategy context onto organisation websites for viewing regionally and nationally. BCFM and Ujima radio station had also anticipated more blood and organ donation related projects and programs to be aired through radio and social media platforms. The radio stations would seek to invite speakers to gain insight from those across faith and cultural beliefs and minority groups. There is still an endeavour to highlight specific insights and understanding surrounding blood and organ donation and transplantation through social media, television, and newspapers prospectively. And there have been some efforts to offer educational packs or toolkits and to include literature and media to proliferate understanding. However, the projection here was to also prompt professional collaboration across organizations as well. So in around sort of the taking ownership strategy. So several outcomes have been projected through this strategy, including one, NHS England continuous professional development continuous professional development or CPD plans. It was in around January 2014. January 2014, one of the campaign collaborators had a meeting with one of the heads of NHS England's head for equality and inequalities, and wherein there was a discussion on aspects regarding the campaign aims and objectives and projections. The meeting prompted detailed dialogue with a view to potentially see that NHS England or Department of Health implement an accredited CPD learning and workshop activities through NHS through the NHS England or Department of Health aligned to local NHS trusts. So thus prospectively also see that there is more inclusivity. More CPD to efforts to highlight importance in community and awareness of how blood and organs can help save lives. More regional and national approaches have since taken place. For example, for example, through awareness, through an event awareness sort of effort in around October 2016, in around an awareness day in around May in around awareness day in around May 2019, and also sort of more recently, in around the in around the save a life or save humanity sort of sort of event or CPD, CPD, CPD or continuous professional development event through the British Islamic Medical Association. However, CPD accredited efforts integrated through NHS England, for example, are still required. Reporting and disseminate in around the reporting and dissemination strategy. So several outcomes have been achieved through this strategy, including one, reporting campaign activities. Organizations are representing and supporting the Lord Mayor's campaign would seek to further report activities of campaign using different methodologies, allowing dissemination and PDF formats of any reports. Any reports would be made available, for example, through the RPSG, BMFF, NHS Blood Transplant, UGMA, and BCFM radio stations. Further, main campaign report was made accessible through the Bristol City website retrospectively. Number two, social media reporting. So social media had helped disseminate campaign projections. UGM and BCFM radio station collaborators had publicised specific aspects of the campaign, highlighting where public can get access to campaign underpinnings accordingly. Number three, collaborators published a manuscript surrounding the Lord Mayor of Bristol's campaign in the Journal of in the Journal of Kidney Care in around 2015. In around 2015, and an overview of the campaign was also presented at a joint conference of the European Working Group on the psychological aspects, the psychosocial aspects of children and chronic renal failure, or UOPA, and the European Society of Pediatric Nephrology in 2014. Discussions about blood and organ donation and transplantation and race and diversity tend to focus on supply and demand. Ethnicities and nationalities comprise many different faiths, traditions, strands, and diaspora of communities. The Lord Mayor's blood and organ donation campaign prompted an appreciation of all faiths and communities to enhance understanding and highlighting how services could be effective surrounding blood and organ donation and transplantation. And the collaborative initiatives and campaign highlighted that there could and should be a dialogue wherever possible. Any anxieties expressed by those contemplating wishes to be known, and anxieties should be addressed and alleviated. That draws this audio podcast in around the analysis this analysis edition to a close. This has been analysis edition as part of a manuscript Cyclone, a Bostik Summit, and part of another Storm Robotics production. Thank you.